Hi, dear listeners, and welcome back to Blush and Bloom, the podcast where we talk about women's health, self care, and everything in between. I'm your host, Gigi, founder of Asale, your space for cycle aware and preventive care. I'm really glad you're here with me on this journey to unpack women's health and highlight the incredible things being built in this space. So let's get into today's episode. Okay. Hi, Dr. Shabnam. Thank you so much for joining me on the Blush and Bloom podcast. So, for people meeting you for the first time, please introduce.
Thank you, Gigi, for having me on your podcast. So, I'm Dr. Shabnam Das Kar. Presently, I live in Alberta in Canada. I'm originally from India. So, I was in my previous life, I was working as an obstetrician gynecologist in Mumbai for many years, delivering babies, doing surgeries. Then, a few years ago, I completed a fellowship from the American Academy of Anti Aging Medicine. So, now I have moved completely into functional medicine, and this has been quite a few years. And I'm also trained as a tiny habits coach, which is a method of behavior change. Basically, of course, women's health is very close to my interest because I was an OBGY for many years. That was my primary training. And the other areas that I'm interested in right now, these are the things I mostly talk about, is hypertension, so high blood pressure management, and brain health and behavior. So these are the three things that I mostly talk about.
Awesome. Thank you so much. And I would love to learn more about functional medicine because I haven't heard about that before. So
Okay.
so before we go into that, what drew you into the functional medicine and brain health and also and how all those things connect to women's heart health?
Okay, so functional medicine is basically we look at the whole patient as a single unit, which is like all the multiple systems are interconnected. Because in regular medicine, like I was an obstetrician gynecologist, so I used to focus on only conditions related to the uterus, tubes, ovaries, vagina, vulva, those things. And someone who's, let's say, a cardiologist focuses on the heart and brain and blood vessels. One of the things we forgot because we made these, specialist silos is that the body is interconnected. The hormones from the ovaries are talking to the heart and the brain and the gut and everywhere else. And the brain is talking to the rest of the body, to the gut and the heart and everything else. So in functional medicine, what we do is instead of regular medicine, what do? We patient comes to us, has a certain symptoms. Let us say their blood pressure is high on that particular day, and we tell them, okay, we need to put you on a medication for high blood pressure, or they have diabetes, or they had pregnancy diabetes, and we tell them, okay, your blood glucose levels are high, so either you start on a lifestyle change right away, depending on what the levels are, or you need to start on a medication. But in functional medicine, what we do is we look further upstream. Like, why is your blood glucose levels high? What are you eating? Are you eating a lot of carbohydrates that your body doesn't have the ability to handle? Are you not eating enough protein? Are you sleeping well? Not sleeping well can raise both blood glucose and blood pressure. Then what are your levels of inflammation in the body? We can check that with the blood test. Are you eating food that are not really good for you, like a lot of processed food, high carbohydrates? Those can cause inflammation. So high inflammation levels is one of the worst things that can happen to anyone. It's related to not just heart disease and high blood pressure, it is also related to mood disorders. It is related to any condition you talk about, like chronic inflammation makes it either worse or increases the risk for it. And then the next part that comes is we have an individualized approach. So when I say individualized approach, like for example, what are the recommendations we will give? So sometimes I say my job is way easier than that of a, let us say a family doctor or a specialist, because I start with food and sleep and movement and supplements to manage your, let us say, iron deficiency and things like that. So I don't have a problem telling someone to eat better, eat in a different way, versus a doctor who has only pills to write. It has to be really justified because there are no prescription medications which don't potentially have a risk for side effects. Now, I'm not saying I don't recommend prescription medications, but that's not the only thing I do. It's like I have a lot of other tools in my toolkit. So that is where I think the big difference is in looking at the whole body as a network of networks. So our hormones, for example, they will impact our mood, they will impact how our brain functions, things like brain fog. So it's not just hormones are only affecting fertility or only affecting only important during pregnancy or after menopause, or they are important throughout life. So it's many different things. For one, the patient might have come for one problem, but the causes may be multiple.
Okay, that's very interesting. And I could be wrong, but it sounds like a very holistic approach where you're not just looking at one aspect, you're looking at how everything is connected. And okay, that's very interesting. I love it.
Yeah, I like to call it the multi-pronged approach, because
Uh-huh.
sometimes when you use a term like holistic, then it becomes like, okay, some of it is like pseudoscience. It is not
Yeah,
based on science. So it's not that. It is based in serious science.
that makes sense. That makes sense. Like the word holistic has been
Yeah,
actually
yes, you're right.
okay. Thank you. Thank you so much for explaining that. That's really, really interesting. Okay, so like for this episode, we're talking a bit more about high blood pressure, diabetes, hypertension. Or wait, high blood pressure is hypertension. Anyway, so
Clarify. Gigi, you'll be surprised to know. I was talking to somebody and they said, I don't have hypertension. I said, you're taking under blood pressure medication. That is for high BP. That's so unfortunately, and I didn't know this. This was like a big shock. I said, oh, I need to make sure that when I'm saying hypertension, I should say high blood pressure, because and some people said I don't have high tension in my life, so I can't have hypertension. So tension is a term in India, which is like a lot of stress would be called, high tension. I have a lot of tension. I had to, remember that. I have to remember that when I'm talking. So yes, just to clarify, hypertension is not necessary only because of stress. There are gazillions of other reasons. Both hypertension and high blood pressure.
awesome. Okay. Great. Thank you for that because I didn't know either. So many people, which I didn't even know this, I had to like search for this. Like many people think heart disease is a men's issue. And why do you think this is a very dangerous misconception?
So again, there are lots of reasons. There was a time in medical science where it was thought that heart disease is mostly a problem for men. Women don't have as much. Whereas the truth is, most women will die of heart disease or stroke. A lot of women are aware about breast cancer because of, I think, all the publicity, and a lot of people talk about breast cancer. They don't talk so much about heart disease and stroke in women, because again, for a long time it was thought to be men's problem, or it's a problem for older women, not so much for younger women. But recently a lot of studies are showing that younger women particularly, see, people may still know about heart disease. They don't know enough about stroke. Like hardly anyone will you hear talking about stroke. Thing is, what it all ties down to is high blood pressure or hypertension is the leading cause of death worldwide for men and women. And most people are not aware of it. So all over the world, there are more than 1 billion with a B people with hypertension. Many of them don't know they have it. Of those who have it, many of them don't have it at the optimal numbers at which it should be. They are not on treatment, or they are on inadequate treatment. So, and one of the things that happens is hypertension or high blood pressure doesn't always have symptoms. So you go to the doctor, get your blood pressure measured, and that is when you find out you have. Now, digressing to why a lot of women, the other big factor, which as a former OBGY, I was like shocked when I got to know about a lot of these things. So women have some unique reproductive risks. So things like having pregnancy diabetes, pregnancy hypertension, then having premature delivery, having miscarriages, having endometriosis, whole gazillions of reproductive conditions can raise a woman's risk for heart disease and stroke. And that is something that, forget about women being aware of that, even a lot of doctors don't know. And if you look at, risk calculators, like as an OBGY back when, in my other life, I didn't know a lot of this. I didn't know that once pregnancy is over, their diabetes is controlled, their blood pressure is controlled, it's fine. They are fine for life. No, they are not. Their lifetime risk for heart disease and stroke goes up. And a lot of women are obviously not aware of this. And that's why, let us say they had diabetes during pregnancy, two pregnancies, both pregnancies diabetes, both pregnancies, pregnancy hypertension, and they delivered and everything was fine. Then suddenly, let us say at the age of 40, they go to the doctor and this doctor says, you have diabetes or you have hypertension, and they're saying, I am so healthy, I eat healthy, I exercise regularly. How can I develop all this? But there were these red flags earlier. And the unfortunate thing is when doctors talk about, let us say, heart disease risk, when they do the risk calculators, most of the risk calculators, none of them actually factor in these reproductive factors. So I have created a long list because it's hard to remember. There's so many. So I've created a long list of all the different factors that can raise heart disease and stroke risk in women and dementia as well, so that women can know for themselves what these risks are, and more importantly, what is it they can do for themselves. Like I talk about checking your blood, we'll come to that, checking your blood pressure at home, because that's a fairly simple thing to do.
This is very interesting. I love how you're already like curating the resources for this, especially for. I'm also surprised by the dementia. Like, could we put a bit and talk about that a little bit? Because I am very interested in this. What are some factors that could increase the chances of a woman having dementia?
Okay. So, how much time do you have, Gigi? I can talk until kingdom come. So now,
Is that many? It's that many?
yeah, there
I'm
are many,
scared.
but I think we'll focus on what are the things women can do for themselves. Now, just a little clarification. Everyone has heard of Alzheimer's disease. Alzheimer's disease is one type of dementia where the brain functions. Most people know about memory issues in people with Alzheimer's. So, Alzheimer's is the commonest form of dementia, but sometimes we use the term dementia kind of interchangeably for Alzheimer's. So the correct term would be all cause dementia. There is vascular dementia, there's Lewy body dementia. But the thing is, all of them have some common risk factors. And as you know, probably, that dementia like Alzheimer's don't have any curative treatment today. So that it means people cannot just take a pill and then, Alzheimer's goes away. We can manage symptoms, but lots of studies recently have shown that there are certain risk factors. So dementias like Alzheimer's are not like a single, like malaria. Now you are from Nigeria, so I'm very sure you're familiar with malaria.
Converse.
So malaria is caused by the malarial parasite, which is in the Anopheles mosquito. 'Cause I'm originally from India, so malaria was something we dealt with a lot. And there are very good anti-malarial medications. So once we give the medications, usually, now there are severe forms of malaria too. Usually the disease is cured, right? But we can't
Yeah.
use the term cure for a lot of the chronic diseases. Like, so dementia is one of those which we can't say we can cure, at least today. Now, there are a lot of risk factors. So it's not like one thing, like it's not one malarial parasite causing malaria. It's not like one dementia causing factor. And that is the only thing we take care of. No, it's like many different things. So for women, what happens now? We know that one thing that happens, again, it's different things for different countries, different statistics, because in many of the developed countries, women live longer than men. And in some of the developing countries, maternal mortality rate may be high. So a lot of women die in a young age, during childbirth or just after. So it depends on which country and which kind of. But in many countries, women live longer. So it was thought that because women live longer, maybe that is the reason more of, because age is one of the biggest risk factors for dementias. So women live longer. That's why they have. Another interesting statistics which is coming up now is M- more men have more severe Alzheimer's, and it is possible that they die earlier because of the severity of the disease. Now, that is new information, but we are going back to women. So, what are the top risk factors for dementias? And more importantly, we can lower the risk. Now, I won't make a lofty claim and say we can prevent all kinds of dementia. No, we can lower somebody's risk. And midlife health. So most, people when they're in their 30s, 40s, they are not thinking of dementia. That's like, oh, that's my grandmother's problem or my grandfather's
Mhm.
problem. But
Yeah.
our whole life risk starts much younger. Sometimes it even starts before pregnancy in the mother's womb, some of the influences. Anyway, we won't go back that far. But so some of the top risk factors, of course, for any, whether it is dementia, heart disease, stroke, is diabetes, having uncontrolled diabetes, having hypertension, again uncontrolled, smoking, having your lipid parameters not normal, and I know we'll talk about lipids later. Then alcohol, excess alcohol intake. These are like the top risk factors for all these conditions, including dementia. Now, with dementia, there's certain other factors, things like, physical activity. If they're mostly sitting, sedentariness is important. Again, it's important for, like, the common risk factors for dementia, heart disease, stroke. So when somebody manages these one area, they reduce their risk for a whole lot of things. So then the other one, big one, is sleep, not sleeping enough and not getting high quality sleep. Then, when it comes to dementia, things like hearing, vision, and the sense of smell, like some of the earliest symptoms for Alzheimer's may be someone's loss of sense of smell. And smell is not something that is routinely checked, right? Like, unless someone has a problem. And during COVID, of course, a lot of people, I think some of us suddenly became aware that we have a sense of smell when it went away. So, routinely, we don't check for a sense of smell unless someone comes and says, my husband didn't even smell the burnt toast, So that is when they realize, oh my God, like his sense of smell is not okay. Then hearing is again something that can be tested, but it's not always tested. And vision. Vision is, so these are the primary senses in our bodies which tell us about what is going on in the world, and how those are very important for survival. The question would be, why are these important? So these are important because sometimes it could be that there is an underlying problem which is affecting all of these conditions. So dementias and some of these conditions are called neurodegenerative. Neuro is nervous system. Degeneration is, as you know, degeneration. So it could be that the underlying neurodegeneration problem is affecting the vision, this thing, but sometimes vision problems are also because of uncorrected cataract, and cataract can be corrected easily. Then hearing, so adding a hearing aid for people who have problem with hearing, that can lower the risk for dementia. Sense of smell is a little bit more difficult because there are some trials using essential oils to train the sense of smell, and that has worked in COVID, loss of sense of smell as well. So, but these are not things people commonly talk about, or they do. Now, adding a hearing aid, see, the other thing that happens is once someone's vision and hearing is not working, what do they do? They kind of stay away from social gatherings and things like that because they can't hear well, they can't see well. Loneliness, so not enough meaningful social interaction, is a big factor when it comes to any diseases, whether it is dementia, heart disease, stroke, all of them. So now see how interrelated they are.
Yes.
So the thing is, what we do in our practice is we do a risk assessment. So, what is your blood pressure number? For most people, again, there are caveats. Normal blood pressure is less than 120 by 80. For women, probably the numbers are lower, but we don't have enough studies yet for that number to come into the guidelines. But most experts agree that the lower the blood pressure, the better it is. But that does not mean the person has to be on 20 medications, because it doesn't mean like your blood pressure is so low that when you stand up, you feel dizzy and fall. So not that kind of thing, but there's so many other things to do for, managing high blood pressure. Deep sleep is one of the big things, which, a lot of people don't talk about. Deep sleep and hypertension. So, blood glucose, blood pressure levels, how many hours of sleep do you get at night? Do you feel rested when you wake up in the morning? How many hours of continuous sitting do you have? Because, see, the nature of our work is such. I'm standing now because I have a sit stand desk, but that was deliberate by design. The default mode is to sit, isn't it, Gigi? All of us sit in front of a computer.
I mean, I'm sitting, so
Yeah, no, so this is, so I'm sorry, I didn't mean it to. But I'm saying in general. And I would have
mm,
been sitting too, unless I made a deliberate effort to
yeah.
change the environment. So from again, I'm putting out my behavior design and, tiny habits hat. Our environment decides so much about our behavior. So I got rid of my office chair. Then my son came in, so he had a chair. So I put it under the table so that I don't see it. If I don't see it, the chances are very less that I'm going to use it. And I keep my table at my standing height level. So the default is standing, not sitting. So
That's
during
right.
meetings, sorry.
I said that's really good. And I noticed that I didn't even notice that you were standing, honestly, because I think you've mastered the art of just standing at the standing desk because I notice people usually like sway a little
Oh,
bit.
another tip that I sometimes forget to mention is if you're using a standing desk to get a anti-fatigue mat. So these are thick rubber mats, and not to stand throughout the day. It has to be interrupted. Sit stand. And when standing, I find my anti-fatigue mat one of the best investments because I don't feel like my feet don't feel tired and. And if you wear high heels to the office, I've not been wearing high heels for so long. I don't even remember what it feels like. But anyway, those are just practical tips because that is what helps people. If someone's standing on uncomfortable shoes for 2 hours, they're not going to continue standing for long. It has to work for you. So, number of hours of continuous sitting. And there are some online calculators where people can calculate, like the commute, going to your workplace. Like originally from Mumbai, and Mumbai, the traffic is like crazy. You spend hours and hours on the street. And the other thing is, most of the time in Mumbai, people are not driving their own cars. They have someone to drive themselves. And I'm sure it's similar in Nigeria as well. A lot of people have drivers. They don't drive themselves, right?
It depends.
Yeah, it depends. So it's like your commute may be very long and you're sitting continuously in that. Obviously, can't stand during that. Then the number of hours spent sitting continuously at the workplace, working on a computer, then coming back home, watching television for many hours at a time. So these are all things that you can add up and you see. So the best thing to aim for is less than 2 to 3 hours of continuous sitting. It's not like I'm not talking about interrupted sitting. So less than 2 to 3 hours of continuous sitting a day. And in Canada, there is the daily movement guide. So it's 24 hours. Over the 24 hours, people spread it out. So time spent standing, cooking, gardening, all those are good things. So those are included in that, when you make the calculations. That is something important to think about. So these are things that people can do for themselves. Then, of course, there are going to the doctor for labs. What are your lipid numbers and which particular lipid numbers are you focusing on rather than the good and the bad lipids, LDL and HDL. There are so many more things besides that.
Okay. Thank you so much for sharing. I think you already like answered one of the questions already around like tips. So thank you so much for the very
You're welcome.
comprehensive answer. Okay, so the next question is going to be around women's symptoms and how they may be different from symptoms that are associated with stroke for men. So what are your thoughts on this? Because I hear that some women may have pain and then they just ignore it because it doesn't click to them that this could be a stroke because we're just accustomed to ignoring pain at some.
Yeah. So I'll talk about stroke and heart disease. When we say heart disease, there are many diseases, but
Mm,
mostly heart attacks, which are the more commoner ones. So heart attack is when the blood supply to the vessels to the heart are obstructed in some way or they don't function as well. And the heart muscles don't get the blood supply and they have something called a heart attack. So, and stroke is the similar thing happening in the brain when the blood supply to the brain is interrupted, usually because of a clot or sometimes from bleeding. So, women, what happens when you talk about pain? So, here we are talking about heart disease. Now, 70% of women do present with chest pain. And I will just pull up one slide so that sometimes I feel that, it's easier for us to relate to something when we are using
visuals.
tool. Okay, give me a minute to share my slide.
Awesome. I can see it.
Okay, show my screen anyway. So I will go to Oh, I'm sorry about that. I have to get used to I have to get used to Google Meet. Okay.
Awesome.
Can
All good.
can you see my slide which shows okay, this is for stroke. I'm going to heart attack. So most women have chest pain, just like men. I'm just going to talk more about the presentation rather than the underlying medical problem because that's like that would need a lot of time. But what happens is sometimes women and including their doctors may miss because women may sometimes have symptoms of like profound fatigue or they have nausea, vomiting. Now, most people are not thinking when there is vomiting or anything like that, that it could be a heart attack. So you can see in this particular slide, There could be discomfort or pressure on the in the center of the chest, sometimes fainting, pain in one or both arms, shortness of breath without any chest discomfort, inability to sleep. And a lot of women, particularly in the perimenopause and menopausal transition, menopause, have problems of sleep. So they might just think that, oh, it's just like my insomnia just got worse. Unusual fatigue for a few days, breaking out in a cold sweat. Something like I work with a physician, she's a emergency room physician, jaw pain, pain in the jaw. Now, who would think that, a jaw pain is actually a heart attack happening? So sometimes what has happened is, and particularly for younger women, they have found that, when even in a younger woman, even when they've gone to the ER with chest pain, sometimes it's a little atypical. It's not the typical, the men's style of chest pain and going to the left arm and all that. They've been told you're too young to have a heart attack, or it could be just stress, or it could be menopause, it could be like perimenopause, a lot of other things that are. So women have had to face that, and that's why they need to advocate for themselves. So my point is, if you or anybody is experiencing these symptoms, particularly like some people have even ignored chest pain. Because see, when here we're talking about women, when women ignore their symptoms and don't go to the emergency on time, see, time is heart tissue. Time is equal to brain tissue when it comes to stroke. So delay is very dangerous. And the less time that is wasted in contemplating, oh, this could be just something I ate that did not agree with me yesterday. It's much better, in my opinion, to go to the emergency room and rule out whether it's a serious problem. Maybe it's not a serious problem, but that's good. Then that's fantastic news. But what if it is a serious problem and you're ignoring it? And you're missing out on the golden time when your heart muscle and brain could have been saved much better. So this is for heart disease. So women, remember, don't blame it on stress, don't blame it on, other stuff if you have any of these symptoms. And more importantly, sometimes in the emergency room, depends on, different countries have different systems, but remember that you need to sometimes tell the doctor. Like I have told my patients, I said, sometimes you might need to tell the doctor, doctor, do you think I'm having a heart attack? So if then sometimes it might happen that, okay, yeah, we do need to rule out that. That's why I'm very optimistic about new technology, where I think a time is going to come when we'll have an AI tool telling the doctors or even the patient that this could be a heart attack. You need to rule it out from our electronic medical records. So that's a different conversation. But going on to, so next is about stroke. Again, stroke in younger women is becoming more common. Now, again, it's not so super common, but at the same time, like Gigi, you said at the beginning, a lot of women will say, I wish I knew this. I could
Yeah.
do something about it. Like
Yeah.
pregnancy hypertension, pregnancy diabetes. These are things that you can measure your blood pressure at home. You can check your blood glucose levels after delivery many months later, and your lifetime risk goes up. So, if women know that their lifetime risk for these things go up, then
Hmm.
they probably not ignore them as much, and also not ignore some of these symptoms that come up and say, I am so healthy, I can't be having a heart attack. Sometimes, Gigi, it's our cognitive biases. We feel that no, bad things happen to other people, not to us. This is
Exactly.
this is from neuroscience, not from me. So it's like, oh yeah, I just smoke one cigarette a day, so I can't be at risk. That kind of, other people are at risk. I'm not the one because I don't smoke so much. So anyway, those are the kind of things that, we sometimes, most importantly, women should not ignore. Women, or if you are, let us say you're in a room and you have aunts or uncles or, mother, and they are having these symptoms, make sure that they go to the emergency room to rule out. The next that comes is, I'll talk about stroke. So I really have to learn how to maneuver this properly. Sorry. So stroke, again, this is an important slide to remember. It's called Be Fast. So Be Fast is, let us say you can see this happening in somebody. They lose their balance. They are not able to stand properly. Then eyes. If anyone is complaining of, oh, my vision seems to have worsened than before, or they have problem focusing. And if it's their face, so you can ask a person to smile and you find that one side of their mouth goes down, the other one is going up, but this one side is not going up. Arm, you can ask them to raise their arms and one arm is either falling down, or they're not able to raise both arms together. There is slurring of speech. So the T in the be fast goes for, here it says 911 because in the US 911 is the emergency phone number, in Canada as well. But for many countries, the T, the times stands for, go to emergency, whichever is the major emergency hospital in your area. And why I say major emergency hospital, because many countries like in India, there is no emergency service that is always reliable and available everywhere. Bigger
Mhm.
cities have, but also it's very important for people to know which hospital to go to, because in India, there are sometimes small hospitals where they don't have the ability to handle a heart attack or a stroke. So time is wasted in going from one hospital to the other. So
Mhm.
I always tell my patients in India that you need to go to a multi-specialty hospital. I'm sure it's similar in many other countries as well, where there are sometimes it's a small hospital, it's a maternity unit only. There is nothing else available there, no emergency care. So
Mhm.
don't go to that small little hospital in your neighborhood when these symptoms happen. You need to go to a major center. Like in countries like Canada, when you call the emergency service, they know which hospital is going to take care of this, so they know where to go. This is very important because sometimes a lot of time is wasted in going to the wrong hospital. Again, different places in the world have different healthcare systems. So, depending on where you are in the world, you know what your healthcare system is and where you should go. It's very important. Like countries like Canada, we don't have to call emergency and then you don't have to worry. Like, they will know what to do and where to take you.
Thank you so much for sharing that. I didn't even know the acronym, that there was an acronym for it. Okay.
Maybe, it's a good idea to put it up sometimes because, if it's not in front and center of your attention, unless you're a doctor or a healthcare provider, these are not things you think about.
Yeah. Thank you so much for sharing that. So for how often do you think women should be checking these levels? Because you already mentioned that it's important for us to check blood pressure, cholesterol levels. So I think there's APOV levels. That was new for me.
Okay. So we all know that we need to, when someone goes to a doctor, this is anywhere in the world.
Mm.
They go, and most of the time, a lot of people go once a year for what is called an executive health checkup. And sometimes when they work, their workplace insists that they should go for a health checkup. So depends on what it is. So they go to the doctor. They have certain like basic tests that are done. One is blood glucose, fasting, and post meal. Blood pressure is always supposed to be checked at every doctor's visit, regardless of age, actually, because there are a lot of younger people who have hypertension and don't know. Then lipids. So when it comes to lipids, standard lipid panel is usually a total cholesterol, then LDL and HDL. So LDL-C is called like if it's high, it's the bad cholesterol, and HDL-C is the good cholesterol. But it's not as simple as that. Then there is another component called triglycerides. Having triglycerides is a much bigger risk factor for women than good or bad cholesterol. And the ApoB100, that is also a cholesterol number, and the other one is LP little a. So ApoB100, LP little a are two tests that, in my opinion, everyone should have them done, and they are available all over the world. So what happens is when we say abnormal lipid meaning in medical terms, it is like atherogenic dyslipidemia. So what is atherogenic? Atherosclerosis is the underlying problem for heart disease and stroke. And that is basically, sometimes, people tend to think of heart disease as a plumbing problem. It's like, I have a block in my arteries to the heart, like I have a 50% block and I have a 70% block or a 90% block. I just have a 10% block. So it's sometimes this is a wrong impression that I think doctors have been giving to patients, that it's like a plumbing problem. So a 10% block is not, or a 15% block is not as bad as a 70% block. Sometimes it is, sometimes it is not. So it's not a gradual, like, the drain getting blocked by a lot of plastic bags, things like, it's
Yeah.
not like,
Yeah.
it's an underlying process of inflammation and, immune system problems. So atherosclerosis, and that is where lipids come in. So once that inflammation process comes in, lipid particles get in. So when I'm talking about ApoB100, that is a blood test. ApoB100 measures all the harmful lipid particles, whereas an LDLC or HDLC alone does not. And sometimes HDL and LDL are just calculated, they're not actually measured. And if a person has high triglycerides, those LDLC, the calculation is not very accurate. So ApoB100 has been found to be high sometimes in people who have a normal LDLC. So this is a gap because they think I'm fine, my lipids are normal, my LDLC is okay, but they don't know that they have something else brewing in the background, which can be tested with a fairly simple test, the ApoB100. Another test is LP little a, so again, lipoprotein little a, and that is again supposed to be a genetic marker. So if people test it once in their life, it should be okay. But women, it has been found that after menopause, sometimes LP little a levels go up. So measuring LP little a once in earlier in life and then again measuring for women after the age of 60, 65 is important because sometimes it goes up later. Now, here is one challenge that we have. So if LP little a is high, obviously the question comes, how do we lower it? So studies have shown that there are some medications that can be used. Most people say lifestyle doesn't change LP little a levels. But anecdotally, I have seen in my practice many people when they lowered their carbohydrate intake, they sleep better, they move more, their LP little a has gone down. But this is anecdotal, not from studies. What we are waiting for is to see whether actually artificially lowering LP little a will save lives. That study is still ongoing because we can't make, in medicine, we can't make lofty claims like, because it sounds very logical, right? Gigi, that if your
Yeah.
LP little a is high and you lower it whichever way it is with medication or something, you should be fine. But in
Yes.
medicine, we have to actually show that in a trial that you will be fine. you know, before
Yeah.
we can make some claim that, oh, I'll just reduce your risk for heart disease. So if ApoB100 is high, what are some of the things to do? Again, it's like I sound like a stuck record because I talk about the same things. Lower your carbohydrate intake, maintain optimal blood glucose levels, maintain, of course, blood pressure is not related to lipids, but it's important. Then sitting, sleep, what type of food do you eat? Blood glucose levels have probably the biggest impact, even in people who don't have diabetes today, if the levels are trending up. Like women with PCOS, or the doctor has told them you have pre-diabetes, they have belly fat, they have fatty liver, they have struggle losing weight, all those things, they have had pregnancy diabetes. All those factors will impact how the lipids are controlled. So in our practice, what we do when patients come into the practice, of course, we do a baseline testing. So for people, listening to this once a year, like if you're listening to it today, get your labs done once right now and measure your blood pressure at home. Then next, how soon to repeat it? LP little a, we usually don't recommend repeating, but again, it depends. If it is normal, then maybe in 6 months to a year is okay to repeat. But I would say a year is sometimes too long if it is already trending up. Because if it is trending up, then you want to make some changes right away and then in 3 months repeat the numbers and see. But no point in repeating the numbers in 3 months if you haven't made any changes in between, because nothing is going to change unless you change. So we repeat usually every 3 months if there are abnormal numbers. And of course, in between the 3 months, we have suggest what are the strategies you can do to manage this better, all the different things I talked about. And for others, it depends. Like sometimes 6 months to a year is, sometimes I feel 1 year is too long if the numbers are trending high. So it would depend. If the numbers are low, then maybe something like iron. Iron deficiency is so common for amongst men as well as women. Women, it's more because of bleeding during,
Yeah.
the menstrual cycles. And iron deficiency is a relatively easier thing to correct. There are a lot of wonderful supplements available in addition to food. Food alone is not enough for severe iron deficiencies. And a lot of people have, dietary restrictions like they are vegetarians or vegans. If
Mhm.
they don't eat a lot of meat, then they are not going to get enough iron or B vitamins as well. So
Mhm.
another very common deficiency. So it's very hard to say how often you need to test. It would depend on what your baseline numbers are.
Okay. Thank you so much for sharing that. That gives more clarity on this. Thank you so much.
Well,
So for women who, we already like discussed this earlier a little bit, but for women who may go to the hospital, for example, and maybe they're experiencing like the symptoms that we talked about, and maybe let's say that a woman is having chest pain and she goes to the hospital and she's feeling she's ignored or they're not listening to her and they're telling her like, just go home, you're fine. How can she better like stand up for herself and tell her like, listen, you have to pay attention to me. This is serious.
It's not an easy question to answer, because what I always say is I tell the patients that you need to tell the doctor, do you think I'm having a heart attack? Now sometimes some doctors may be open to saying yes, we need to rule that out, and they've already thought about it. But sometimes women are, again, not a judgment on my colleagues, but it can happen. I know a lot of my colleagues will tell them, you are you the doctor or am I the doctor? Do you know? Like, it has happened. So I won't. Many women face this challenge that they are told how, like, and when they say, no doctor, I know there's something more serious than just stress, sometimes women have been dismissed off as, oh, it's all in her head, or something like that. So it's hard. That's why I keep saying I am more optimistic about technology helping some of these things. Like, if the electronic medical record tells the doctor that you need to rule out a heart attack in this patient, then it might work better. But again, we have to see what happens in the future. And this is what I keep saying. I said, sometimes you should not blame the doctor all the time, because maybe the ER is extremely busy. The doctor is working continuously for 48 hours at a stretch without any sleep. We can't always rely that a human being will be, 100% on the job all the time. Like, some of the things are major, like a chest pain, or a woman coming with fatigue, and you're saying, no, you're fine. That some things are major. But again, all over the world, the different levels of knowledge, different levels of skill in the ER. Maybe the ER is not handled by a very skilled doctor or nurses like that. Then that's a problem. And those are some of the problems that, because I practiced medicine in India for so many years, I know that how different it is in different parts of the country. So that is one. And when a woman goes to a doctor, see, doctors don't have a lot of time to spend on each patient. So
Yes.
what I tell patients is, when you're going to your family doctor, make a list of all the things that you want to talk about. Now remember that every doctor will, if you have 10 questions, your doctor may not have time to, answer all the 10 at one visit. Prioritize each ones and write them down, because it should not happen that, you go back home after meeting the doctor and you forget to tell the like, you've forgotten completely to tell the doctor that you are having shortness of breath when you're climbing stairs or something like that, which is very significant and needs to be, a lot of things need to be ruled out if you're particularly an older woman. And then you don't get the next appointment for 3 months. Then, like, you're waiting. So write down all the questions. Maybe you'll always have your phone with you. So I suggest having an electronic record rather than pen and paper, but whatever works for you. Some people are comfortable with pen and paper. I always say I tend to lose my pieces of paper. So I make it on my phone because it's always there with me. So those are the things. Make sure that you prioritize which questions to ask. And then it's easier for even the doctor, because when you have a structured consultation like that, and advocating for oneself. Now, before advocating, I think, Gigi, one of the most important things is for people to know. Like,
Yes.
knowledge is empowering. So if women know what their risks are, like someone who doesn't smoke, doesn't drink, has normal blood pressure, has blood glucose levels which are okay-ish, but they had pregnancy hypertension and pregnancy diabetes, then they know that their risk is higher and they need to check more often these levels, versus saying, I didn't know that. If I don't know, how will I take any action? So
Indeed.
knowledge is important, but knowledge alone is not enough.
All right. Thank you. Thank you so much. It's been such a wonderful podcast. Thank you so much for sharing your knowledge. Okay.
My pleasure.
This is really insightful. So we're headed towards the end of the podcast now. So I have 3 final questions for you. So what's one thing you want or you wish every woman listening to this podcast would start doing today to protect her heart and her brain?
Okay, I'll keep it absolutely simple. Check your blood pressure at home. Get a home blood pressure device, and I will share my screen for, because sometimes checking blood pressure at home, what happens is, there are a lot of small things that matter, which people can sometimes, miss out.
Mm.
Share. Okay, you can see my slide. Are you seeing my whole entire slide deck, or is it only one slide?
I'm seeing your whole screen.
I'm going to make sure that it is only one. Okay,
Okay,
now you
awesome.
can see measurement of blood pressure slide.
Yes.
Okay, so here it's very important when we measure blood pressure at home. First of all, You can, you can share this. This is from the American College of Cardiology. It is available online.
Mhm.
So not talking when measuring, emptying the bladder, then sitting with both legs firmly planted on the ground, not crossed, having the back supported, having the arm supported with the device at the level of the heart, having an upper arm blood pressure cuff. Now, there are some newer devices like the one I'm wearing, which measures blood pressure in the background, but these devices are not yet available all over the world. This is available in it's a device called Hilo, and this has made a huge difference to my blood pressure management. And I think I forgot to say I have had hypertension for more than 20 years. So that is one major reason why I'm so interested in. Then not having caffeine. So having the right blood pressure cuff size is very important. Then not having caffeine for half an hour before measuring blood pressure, arm supported, leg supported. And you won't believe sometimes it's so shocking that even in healthcare, like I went to a clinic recently for my annual checkup, and the nurse was measuring blood pressure with my arm in midair. My feet are dangling because I'm short. She made me sit on a examination table, and there is no back support. And I asked her, I said, of course, I was not going to go by her blood pressure measurement because I check mine all the time on that device. I said, normally I don't say these things, but I felt so like this is not right. So I told her, I said, don't you think this is not an accurate way to measure blood pressure? No, this is absolutely fine. She told me, no, this is quite accurate. It was like, I didn't know
Wow.
whether to laugh or cry. And in fact, a few years ago, they did a study where they asked, doctors to check blood pressure, and many doctors had failed. So this is very important to know and keep it in mind. And that is why I talk about measuring blood pressure is irksome, because you all you have to think all these criteria, because one small thing like a full bladder can change your blood pressure levels. Having a dangling arm can change it by 4 to 6 millimeters of mercury, and that is a very significant reading.
Mhm.
The next thing that I want, so for women, get a good blood pressure device. And there are some websites which have these clinically validated ones. There's one called Stride, bp.org, STRIDE, bp.org, that has international blood pressure devices on it. So check those and get a blood pressure device home. It's actually, I would say it's a very good investment on your health to have a good blood pressure device at home. And check your blood pressure. Again, like I said, it depends on what numbers you have. If the numbers are high, of course, you need to go to the doctor to find out what to do. And these are the numbers that people need to look for. Now, this particular graphic is from the American Heart Association. This is like fresh off the press, hardly a week ago, because very recently the American Heart Association and the American Cardiology Society, they've updated the guidelines for hypertension. So again, some of the things have remained the same as before. Normal, like I said, is less than 120 and less than 80 for most people. Women probably need lower. And this was a level which was, if someone went to the doctor with this level, most of the time they were told, okay, I'm not going to put you on medication. You go home. These are the lifestyle changes you need to make. Reduce your salt intake, lose weight. 5%, just a 5% weight loss is enough to lower blood pressure. Now weight loss is a big conversation, because people can lose weight on anything, like eating, as my associate says, a cabbage soup diet or anything. But the biggest challenge is in maintaining the weight loss, and that is a challenge a lot of us have, and we've gone through that. And it's nothing wrong with us personally. It's a challenge, it's a problem of the biology. So weight loss and maintaining the weight loss is important for lowering blood pressure. Now, what has changed in the newer guidelines is, in this particular range, if in 3 months' time, 3 to 6 months of lifestyle changes. Now, not everyone is able to make all those lifestyle changes. They go back to the doctor and their blood pressure has not come down. The recommendation now is to start a medication. So, this is again something that a lot of doctors also don't like. Not everyone is updated with their knowledge. So this has been found to be one of the problems with blood pressure management is many doctors don't intensify the treatment when they find the levels are still not okay. And sometimes it's patients who'll say, doctor, my blood pressure goes up when when I'm in your presence in the clinic. At home my numbers are fine. So important to check blood pressure at home, because that is a more, and frequently, because that is a more accurate way to judge your blood pressure levels rather than a single measurement with, like I said, arm dangling, back unsupported, legs dangling.
No, I didn't know there was I haven't taken somebody's blood pressure before. I didn't know there were guidelines for this because I think the last time I even got my blood pressure taken, I was yapping the whole time with the doctor.
And your arm was on the lap and not like supported on a table.
It was somewhere, but it wasn't
Yeah,
resting
it's
for
like,
sure.
yeah, I know it's sad that these are simple things, but they make a huge difference.
Thank you so much for sharing that. This has been so insightful. Very
I'm happy.
Yeah, this is so cool. So I have two more questions for you,
Go
and
ahead.
I think this is going to be a very fun question for you because what would you tell 15-year-old you?
When you sent me that question, I thought, oh my God, like that was a long time ago. So, what would I tell my 15-year-old self? I think one of the things I would tell, and I was like very naive. The only thing I knew to do was, I think, study, and I was good at academics and loved studying and reading books. So, I was one of those quiet persons. So, what I would suggest is number one, think bigger. And think bigger is easy to say, but how will you start thinking bigger unless you are in the presence of people who are much better than you and who are bigger thinkers? And sometimes all of us may not be fortunate to be having a very good education, or at home everyone doesn't have the same opportunities.
Mhm.
So having the opportunity, and now it has become easier because you can also reach out to people online, like listening to podcasts on YouTube. These are like, YouTube is okay, you have to tolerate the ads, but otherwise it's a free tool. And again, who do you listen to? What should you be the criteria? Because as you know, there are a lot of people who talk a lot of things, and particularly in medicine and health wellness field, where
Mhm.
they may not have the knowledge. So check the credentials of the person talking. Is this person someone who sees patients in the clinic or is a researcher, versus someone who is, influencer was not a designation when I was growing up. So
Yeah.
not an influencer who's trying to sell you a supplement. We have to make sure what is the source of the information. And particularly sometimes people can seem very persuasive. They speak well, they look good, and it sounds very
Charisma.
convincing. Where, yeah, a lot of charisma, and versus, someone, a nerdy doctor who like is not even looking at the camera. So very important to spend time with people much better than yourself. If
Mhm.
you spend time with people like you, then, I 100% sure my thinking would not, like, that is something I would encourage my 15-year-old self. Think bigger, spend time with people much better than you, but again, be circumspect about what you're following and who you're following.
Mhm.
I remember one of my mentors used to say, the same person cannot be the benchmark for everything. Like, let us say a person who's very successful in his business career, but his personal, life is like he doesn't have a good relationship with his kids or anything. Then don't
Yeah.
follow his relationship advice. Follow his business advice. But for your relationship advice, maybe family where they are not super wealthy, but they have very good relationships between the children and the parents. They have a lot of good communication. So maybe you can learn the communication skills from them, but don't take their financial advice.
Thank you so much. This makes perfect sense. Thank you so much for sharing.
You're
Yes.
welcome. My pleasure.
Then the final question is for someone who wants to learn more about you and your work, where's the best place for them to find you?
Okay, I have a website. It's drkarmd.com. So drkarmd.com. And if anyone wants to sign up, I have a weekly email, which is I talk about blood pressure and brain health and these things. And so that is drkarmd.com/email, email. You'll be taken to a form to sign up for my weekly newsletters. And it's been wonderful being on your podcast. Thank you so much.
Thank you so much, Sue. I will include the links to your website and to your newsletter in the description and in the show notes for our listeners. So thank you so much. It's been a
Thank you
pleasure
so
speaking
much.
with you. I can't thank you enough because I learned so much from this episode. Thank you.
Oh, you're welcome. And I hope your audience gets to learn a lot as well. Thank you.
I'm sure they will. Okay.
Bye now.
Hi again. Thank you so much for listening to this episode of Blush and Bloom. I'm so glad you joined me for this conversation. If you found it helpful, please share this episode with a friend or someone who might need it. Let's keep talking about women's health and working towards better outcomes for all of us. You can find more episodes and resources at www.asale.tech and check out our app at www.asale.health. And you can follow us for more updates on Instagram at asale.tech. Until next time, I'll see you in the next episode. Take care and bye-bye.